Hello everyone. Imagine the pipes in your home. If water pressure is permanently set too high, eventually something is going to leak, burst, or ruin your appliances. Your body is no different. Hypertension or high blood pressure is essentially high pressure in your internal plumbing. It's the leading preventable cause of heart disease and stroke worldwide. Yet, it's often the most misunderstood. We are going to break down the science of that pressure and the simple shift that can save your life. So without wasting any time, coming to the topic hypertension, presented by Rajesh Das. Before going to the hypertension, first of all, we have to know what is meant by blood pressure. Blood pressure is the force of blood pushing against the wall of the arteries when the heart pumps blood. In a simple form, blood pressure is the pressure of the blood inside your blood vessels when the heart pumps. Now coming to the definition of hypertension. Hypertension is defined as a persistent elevation of the systolic blood pressure at a level of 140 mmHg or higher, and of diastolic blood pressure at the level of 90 mmHg or higher, which simply means high blood pressure, where the upper number of the blood pressure, which is called systolic blood pressure, is 140 mmHg or more, and the bottom number, which we call diastolic blood pressure, is 90 mmHg or more for a long time. Coming to the etiologies of blood pressure, hypertension. There are two etiologies, modificable and non-modificable. Modificable etiologies are stress, smoking, alcohol consumption, obesity, use of caffeine, and dietary salt intake. Coming to the non-modificable etiology, these are family history, age, and gender. Now coming to the classification of hypertension. There are 6 classifications of hypertension. We can see one by one. First, primary hypertension. Second, secondary hypertension. The third classification, white coat hypertension. Fourth classification, isolated systolic hypertension. Fifth classification is malignant hypertension. Sixth classification is resistant hypertension. We can see one by one. Primary hypertension. Primary hypertension is high blood pressure that develops slowly over time without any specific known cause, which means it is a high blood pressure that develops slowly over time without any clear or known cause. There is no clear cause in the case of primary hypertension. Coming to the etiology of primary hypertension, these are the exact cause of the primary hypertension is unknown. The other causes are diabetes mellitus, hormonal changes, and genetic factor. Coming to the secondary hypertension. Secondary hypertension is high blood pressure caused by another medical condition like kidney disease, hormonal disorder, or certain medicines. It means uses of certain medicine or any kind of renal disorder, kidney disease, hormonal disorder, it can lead to secondary hypertension. Coming to the etiology of secondary hypertension. These are renal disorders. Renal failure, it comes under renal failure, glomerulonephritis. Glomerulonephritis means inflammation and damage to the kidneys filtering units. Then coming to another one, endocrine disorder, which means Cushing syndromes. Neurological disorder like brain tumor, head injury. Note, Cushing syndromes. It is a condition where the body has too much cortisol hormone for a long time, causing weight gain, round face, and high blood pressure. Coming to the third point, white coat hypertension. White coat hypertension is when a person's blood pressure becomes high only in the hospital or clinic due to anxiety, but is normal at home, which means it is occur when a person's blood pressure becomes high only in the hospital or any kind of clinic because of anxiety, but it stays normal at home. Coming to the isolated systolic hypertension. Isolated systolic hypertension is a condition where the upper blood pressure, which is called systolic blood pressure, is high, but the lower number of blood pressure, which is called diastolic blood pressure, is normal. In this case, the upper blood pressure or the systolic blood pressure will be high and the lower blood pressure will be normal. Coming to the malignant hypertension. In the case of malignant hypertension, it is a sudden and very severe increase in blood pressure, usually above 180 by 120 mmHg. that causes damage to vital organs like the brain, heart, kidneys, and eyes, and it is a medical emergency. It is a sudden and very high rise in blood pressure that can damage our important or vital organs like brain, heart, kidneys, and eyes. Malignant hypertension is the hypertension that is above 180 mmHg and not responds to any treatment. Coming to the last type of hypertension, which is resistant hypertension. It is the blood pressure which cannot be reduced below 140 by 90 mmHg. It is considered as resistant hypertension. It will not come down below 140 by 90 mmHg. Now coming to the clinical manifestations of hypertension. First, cardiac failure, transient ischemic attack, left ventricular hypertrophy, and hemorrhage. These are the main clinical manifestations of hypertension. Coming to the other clinical manifestations of hypertension, these are fatigue, depression, dizziness, angina pectoris, which means heart, chest pain, palpitation, dyspnea, early morning headache, and blurred vision. Coming to the diagnostic evaluation of hypertension. History collection, physical examination, hemoglobin test, blood urea nitrogen test. Blood urea nitrogen test, it provides information about renal function, how the kidneys are functioning. Serum calcium, chest X-ray, and CT scan. These are the diagnostic evaluation of hypertension. Coming to the management, the lifestyle modification, weight reduction. If we are obese, we have to reduce our weight. It can lead to reducing the hypertension. Salt-restricted diet, exercise, stop alcohol consumption. Coming to the medical management, diuretics. The example is hydrochlorothiazide. Diuretics is given to the patient who are suffering from hypertension. Beta blockers. The example is atenolol. Calcium channel blockers. The example of the calcium channel blocker is amlodipine. Vasodilators. The example of vasodilator is hydralazine. Now coming to the complications of hypertension. Renal failure, angina pectoris, which means chest pain, heart failure, cerebral hemorrhage, and myocardial infarction.